Good morning, everyone. So, today we will discuss thermal protection part 2. In part 1, we had discussed about what is thermal protection. In that, we had discussed about that newborn babies they are more prone to hypothermia because they have poor heat generating mechanisms. After that, we had discussed about various sources of heat loss, that is radiation, convection, evaporation, conduction. Then why newborns are more prone to develop hypothermia. Then additional factors that can contribute to heat loss in the low birth weight babies or the preterm babies. Then after that we have discussed about sources of heat production. Then what is hyperthermia. Then different methods of temperature measurement. What is normal temperature, cold stress, hypothermia, moderate hypothermia, severe hypothermia, then hyperthermia. Then we have discussed about different methods, their timing, their then frequency of temperature measurement. Then after that we had discussed about disorders of body temperature. In that we have discussed that there are basically two disorders of body temperature, either hypothermia or hyperthermia. And both hypo and hyperthermia, they are the indicators of any underlying serious illness. Now in today's lecture, we will continue with our previous lecture part 2, thermal protection. Today we will discuss prevention of hypothermia. Now how can we prevent hypothermia? So prevention of hypothermia includes warm chain. Now what is warm chain? Warm chain, it is the strategy for prevention of hypothermia is known as warm chain. Means the strategy which we adopt for the prevention of hypothermia is called as warm chain. Now, warm chain is a set of 10 steps which are aimed at decreasing the loss of heat, promoting heat gain, and ensuring that baby is not exposed to the circumstances that can lead to hypothermia. So basically, what do we understand by warm chain? That warm chain, it is a strategy for prevention of the hypothermia. Now this warm chain, it contains 10 steps. It is a set of 10 steps, and the aim of the warm chain is to decrease the heat loss, to promote heat gain, and to make sure that baby is not exposed to any circumstances that can lead to hypothermia. And that circumstances could be exposure of the infant to cold environment or any low ambient temperature, exposure to cold surface, cold air, or when the baby is not clothed properly. So it is the aim of the warm chain to make sure that baby is not exposed to any such circumstances which can result in hypothermia. Now, what are those 10 steps? So, 10 steps of warm chain are: first step, warm delivery room, warm resuscitation, immediate drying, skin to skin contact, breastfeeding, bathing postponed, appropriate clothing, mother and baby together, professional alertness, and warm transportation. Now, these are the 10 steps of the warm chain: warm delivery room, skin to skin contact, immediate drying, warm resuscitation, warm transportation, bathing postponed, appropriate clothing, skin to skin contact, that is KMC, professional alertness, mother baby together. Now we will discuss each point in detail. Each step we will discuss in detail. So, warm delivery room. The birthing room should or the delivery room should have ambient temperature of at least 25 degrees centigrade, and the room should be free from draft of the air. Means all the doors and the windows should be kept closed. So there is no exposure to any draft of the cold air, and the temperature in the delivery room should be at least 25 degree centigrade. Then after delivery, the baby should be dried immediately. Immediate drying. So immediately after the delivery, the baby should be dried immediately. And the newborn should be put in skin to skin contact on the mother's abdomen and covered by warm and dry linen. The baby should be capped and dressed properly because The head constitutes a major portion of the loss of the heat. The wet towel should be discarded. Any wet towel which is in contact on the baby's body, it should be discarded immediately. So immediately after the birth, the baby should be dried immediately and should be put in skin to skin contact with the mother and should be covered with warm and dry linen. Then kangaroo mother care, skin to skin contact, that was a step in warm chain. So skin to skin contact means kangaroo mother care. And kangaroo mother care, it is the best way to keep the low birth weight baby warm. Now here is the image which is showing how the baby should be wrapped in a dry linen. Kangaroo mother care is the effective way to keep the low birth weight baby warm. Then breastfeeding. So frequent breastfeeding is very important. It is very critical to provide energy to keep the baby warm. Then the bathing and weighing are postponed. Now, when we weigh the baby, this point we had discussed in the care of the newborn, that care of the newborn in the initial few hours after the birth. So we have to weigh the baby. So the weighing of the baby and bathing the baby should be postponed. Means because when we have to weigh the baby, we have to record the weight in the nude. So the bathing and the weighing of the baby should be postponed. And the term babies, the babies who are born at term, they should be only given sponge bath, and that too also after 24 hours of the life in the summer months. Bathing should be postponed during winters and in the sick babies or the low birth weight babies until the umbilical cord falls off. That is approximately at the end of the first week. Now, what we have to do when we have discussed this point, bathing postponed. So, in bathing postponed, what we have to do after the birth, bathing and weighing of the baby. Because when we weigh the baby, when we record the weight of the baby, that we record in the nude position. So, bathing and weighing of the baby should be postponed. And even in the term babies, term born babies, only sponge bath can be given, and that too also after 24 hours of the life, and that too also in the summers, and in the low birth weight babies, sick babies, and in the winter months. Bathing should be postponed until the umbilical cord falls off. That is at the end of the first week. Then we have to dress the baby in multiple layers of the warm and light clothes, because this provides better thermal protection than a single layer of a heavy woolen clothing. So it is very much important that when we are covering the baby, when we are clothing the baby, we should dress the baby in multiple layers of the light cloth, multiple layers of the warm and light cloth, instead of the single layer of the heavy woolen clothing, because this multiple layer of the warm and light clothes, it provides better thermal protection as compared to a single layer of the heavy woolen clothing. So dressing the baby in multiple layers of the warm and light clothes provide better thermal protection than a single layer of heavy woolen clothing. Mother and baby should be kept on the same bed, that is co-bedding or rooming in, because in the initial few hours after the birth, the baby is more active. And studies have also proven that any separation during these hours, it is very much detrimental for the physical and the mental health of the newborn. So the attachment becomes more, the bonding, the attachment becomes more stronger in the initial few hours. That's why the mother and the baby should be kept on the same bed. Then warm transportation. Now this is the weakest link in the warm chain with greatest possibility of severe and undetected hypothermia. When we have to achieve the 10 steps of warm chain, so this step, warm transportation, this becomes the weakest link in the warm chain, and there is maximum possibility of severe hypothermia or undetected hypothermia. Then the last step is training or awareness of the healthcare providers, that is professional alertness. until and unless the persons who are involved in the care of the newborn, they realize the implication of hypothermia, it cannot be managed effectively. Now, professional alertness. Until and unless the healthcare workers, the physicians who are involved in the care of the newborn, they do not realize, they do not understand the importance, the implications of hypothermia, the hypothermia cannot be managed or diagnosed effectively. So these were the 10 steps of the warm chain, and the aim of warm chain is to promote heat gain, decrease heat loss, and to make sure that baby is not exposed to any circumstance that can result in hypothermia. Now, management of hypothermia also includes incubators and the radiant warmers. Now, what are incubators and radiant warmers? So, these equipments are used to assist the sick and the small neonates to maintain their normal body temperature. Now, incubators and the radiant warmers, these are the equipments which are very much helpful for the small neonates and helps in maintaining their normal body temperature. Now, what is incubator? So, incubator is basically a transparent acrylic cabin which has warm air circulating around the baby to keep the baby warm. Now, there's a basic difference between incubator and radiant warmer. Incubator is a transparent cabin, and in this cabin there is warm air circulating around the baby. That air keeps the baby warm, whereas the radiant warmer, it is the open system. As compared to the incubator, incubator is a closed cabin in which there is warm air which circulates around the baby to keep the baby warm. There is inbuilt feedback system, servo control, that controls the ambient temperature inside the incubator by altering the heat output based on the baby's temperature, and thereby maintains the temperature of the baby in the normal range. Now, what happens in the incubator? In the incubator, there is a inbuilt feedback system, or we can say servo control mode. And what it does, this servo control mode or feedback system, it controls the temperature inside the incubator. It maintains the temperature inside the incubator. And how it maintains? But it maintains by altering the heat output, which is based on the baby's temperature, and therefore the temperature of the baby is maintained within the normal range. Now, a radiant warmer is the open system as compared to the incubator, which is a closed cabinet, and the neonate lies on the crib. Now, in this also there is overhead radiant warmer that modulates the heat output based on the baby's temperature, which is sensed by the skin probe. Now, skin probe method we have already discussed. So a radiant warmer is an open system and the incubator is a closed cabinet. And in both the systems, that is radiant warmer and the incubators, there is the servo control mode or feedback system which maintains the temperature of the baby. Now, radiant warmers and incubators, they both are used in the servo control mode with the abdominal temperature maintained at 36 to 37 degrees centigrade, which is dependent upon the weight of the neonate. So radiant warmers and incubators, they both are used in servo control mode with abdominal temperature maintained at 36.5 to 37 degrees centigrade, depending upon the birth weight of the neonate. So this was about the incubators and the radiant warmers. Now we will see how they look. Radiant warmers and the incubators. So a very low birth weight baby being cared for in the incubator. This is the incubator. A closed cabinet, acrylic, transparent acrylic cabinet. The baby is well in this. You can see the baby is well clothed and the incubator is covered with the cloth to prevent excessive light or noise for adequate comfort of the baby. This is incubator. In the next slide, we will see radiant warmer. This is the radiant warmer. Radiant warmer in which there is the overhead radiant warmer that modulates the output heat based on the temperature of the baby. Now, sign and symptoms. Now, what happens? Peripheral vasoconstriction results in acrocyanosis, cool extremities, and delayed peripheral capillary refill time. Baby becomes very much restless and then lethargic. Initially, the baby becomes restless and then lethargic. And the peripheral vasoconstriction, it leads to acrocyanosis. Now, in what happens in acrocyanosis? Basically, acrocyanosis is a vascular disorder. It's a peripheral vascular disorder. In this, there is cyanosis of the hands or cyanosis of the feet, and sometimes it appears on the face also. Basically, it is caused by the vasospasm of the small vessels of the skin in response to the cold. So, these are the signs and symptoms of hypothermia. So, this peripheral vasoconstriction, it leads to acrocyanosis. Extremities are cold and delayed peripheral capillary refill time. The baby becomes restless and then lethargic. Then chronic or recurrent episodes of hypothermia results in poor weight gain. The weight of the baby is very low and he cannot gain weight properly. So chronic episodes or recurrent episodes of hypothermia results in poor weight gain. Then cardiovascular manifestations occur in the form of bradycardia, then hypotension, then raised pulmonary artery pressure with resultant hypoxemia, tachypnea and distress. These are the cardiovascular manifestations. Then presence of lethargy, reflexes are poor, decreased oral acceptance and apnea denotes neurological depression. Now, these are the symptoms of hypothermia. Initially, the baby is restless, then becomes lethargic, then cardiovascular manifestations appear in the form of hypotension, bradycardia, hypoxemia, tachypnea, distress, then lethargy, reflexes are poor, delayed oral acceptance, apnea. All these symptoms, they denotes neurological depression. Then peripheral vasoconstriction leads to acrocyanosis, extremities are cold and delayed peripheral capillary refill time. Then acidosis, hypoglycemia, oliguria, azotemia, and generalized bleeding, they can occur in severe cases. These are the symptoms which occur in the severe cases: acidosis or hypoglycemia, then oliguria, then azotemia, and generalized bleeding. These are the symptoms which occur in severe cases. Babies who are chronic cold stress do not gain adequate weight, means recurrent episodes and persistent episodes of hypothermia can lead to poor weight gain. Now, management of hypothermia. How we will manage hypothermia? So, methods for temperature maintenance include skin to skin contact, that is kangaroo mother care, then warm room, radiant warmers, incubators, and increasing ambient temperature by use of hot air blowers or a 200-watt bulb. Now, this is a general management of hypothermia, that how can we manage hypothermia. So, these are the methods by which we can maintain the temperature of the baby, by which we can maintain temperature, by which we can prevent hypothermia or we can manage hypothermia. So methods of temperature maintenance are putting the baby in skin to skin contact with the mother, that is providing kangaroo mother care, then placing the baby in the warm room, then use of radiant warmers or incubators, then increasing the ambient temperature. And how can we increase the temperature? By use of the hot air blowers or a use of 200-watt bulb. All these methods are used to maintain the temperature of the baby to manage hypothermia. Then management of the cold stress or moderate hypothermia. Now, how can we manage cold stress or moderate hypothermia? Now, the temperature of the cold stress was 36.0 to 36.4 degree centigrade. And moderate hypothermia, the range of temperature was 32 से लेके 35.9 degree centigrade. So how can we manage cold stress or moderate hypothermia? So in this we have to remove the baby from the source that can cause hypothermia, such as cold environment, cold clothes, cold air or wet clothing. So remove the baby from all these sources that can cause hypothermia. Then we have to initiate skin to skin contact. If not possible, then we have to dress the baby in the warm clothes and keep the baby in the warm room. Alternately, we can use radiant warmers or the incubators to maintain the temperature. Then after that, we have to monitor the temperature frequently. If temperature of the baby is not rising, then we have to check if adequate amount of heat is being provided. Then we can suspect sepsis if the baby is not responding to hypothermia. We have to also make sure that the baby is getting frequent feeds to prevent hypoglycemia, and we have to monitor the vitals also. Now, this we have already discussed in protein energy malnutrition, that hypoglycemia, hypothermia and infections, they all occur as a triad. So we have to make sure that baby is getting enough feeding, baby is getting frequent feeding. So ensure frequent feeding to prevent hypoglycemia. We have to monitor the vitals. Firstly, we have to remove the baby from any source that can cause hypothermia. Secondly, we have to put the baby in skin to skin contact. If that is not possible, then we have to wrap the baby or we have to dress the baby in warm clothes and keep the baby in warm room. Alternately, we can use radiant warmers or the incubators. Then after that, after managing all these methods, we have to monitor temperature frequently. And when we are monitoring the temperature and we see that temperature is not rising, then we have to check for if adequate amount of heat is provided to the baby. Then we can also suspect there is sepsis if the baby is not responding to hypothermia despite of providing all the management strategies. This is how to manage cold stress or moderate hypothermia. Then management of severe hypothermia. In this, we have to remove all the wet clothing and place the baby in the incubator or preheated radiant warmers or thermostatically controlled heated mattress, which are set at the temperature of 37 to 38 degree centigrade. Alternately, we can also use a room heater. Now, this is the first step to manage severe hypothermia. In this step, we have to remove all the wet clothes. We have to place the baby in the incubator, or we have to place the baby in preheated radiant warmers, or we can place the baby on heated mattresses, and we can also use room heater. Then once the temperature of the baby reaches 34 degrees centigrade, the rewarming process should be slowed down. Then provide oxygen, empirical antibiotics, saline bolus if there is shock condition. Then IV dextrose and vitamin K should also be given, and we have to monitor the vitals. Now, as we are saying that once the temperature reaches 34 degrees centigrade, the rewarming process should be slowed down. Then after that, we have to measure the temperature of the baby every hour for at least 3 hours. Now, when we have measured temperature every hour for 3 hours, now if the rise of temperature is 0.5 degrees centigrade per hour, then we can consider that heating is adequate, and temperature measurement is continued 2 hourly until normal body temperature is attained. And after that, we have to monitor temperature 3 hourly for at least 12 hours. Now what happens here? Firstly, we have to remove all the wet clothes, place the baby in incubator, preheated radiant warmers or heated mattress set at temperature of 37-38 degrees centigrade. Then we can use room heaters. Then once the temperature reaches 34 degrees centigrade, the rewarming process is slowed down. Then Then we have to measure temperature every hour for 3 hours. Now, when we are measuring temperature every hour for 3 hours, in that case, if temperature is rising 0.5 degree centigrade per hour, then we can consider that the baby is getting adequate amount of the heat. After that, we have to measure temperature every 2 hourly until normal body temperature is attained, and then 3 hourly for 12 hours. Now, if the temperature is not rising adequately, then we should check that if the baby is getting adequate amount of the heat. Then provide oxygen, empirical antibiotics, saline bolus. If there is a condition of shock, then IV dextrose and vitamin K should also be given. Vitals should be monitored properly. So this was all about the management of severe hypothermia. With this, we complete with our topic, thermal protection. Thank you.